Good evening, everyone. First of all, I want to thank All India Ophthalmological Society and Women Ophthalmological Society for giving this opportunity to talk about my experience in Australia. And a special thanks to Ranjana ma'am and India ma'am. They encouraged me because I'm not a very good orator. I fumble a lot when I speak in public. I'm a uh, very less talkative person, but still, thank you. Um, so first of all, I want to say about these ICO fellowships. They are basically mainly the short-term fellowships. And India ma'am has already talked about the long-term fellowships, 1 or 2 year fellowships, which are good for the MS graduates, like who has recently passed out and they have time and they can invest their energy, right? So long-term fellowships are for those people. These ICO fellowships, being the short-term fellowships, they can be taken up like even with your busy lives, because they're short-term, so anybody can take. Even established ophthalmologists can take out time from their life and can get these. And these fellowships are generally like observerships kind of fellowships. They do not give direct hands-on. But if you're already an established ophthalmologist, so even this 3-month observership can help you enhance your skills and your practice, because after you become experienced, just by seeing things, you can do new things, right? So Dr. Chaitra has already briefly talked about this fellowship because she has done the same. She mainly told you about the benefits. I will more talk about like the technical part, like how basically to apply for these fellowships. I'll go more into detail. First of all, the ICO, what basically ICO is. It's the International Council of Ophthalmologists. Basically, all the national, regional, and subspecialty ophthalmological societies, they have made this ICO, and they collaborate with each other and they cooperate with each other. Their main vision is to enhance ophthalmic education, improve access to highest quality eye care, and to preserve and restore vision for the people of the world. The main aim is to strengthen eye care capacity in low and middle income settings to address inequities and pressing public health needs to secure eye health. Basically, what ICO aims is that the developed countries, they are already giving a good quality eye care to their patients. What they want is that all societies should work together, and even the developing countries are able to save eyes. So what they do is they take the candidates or the budding ophthalmologists from the developing countries and train them and send them back to their countries, so they can use that enhanced skill in their own country and give a better health care. So the different type of fellowships which ICO provides is 3-month fellowships, which is available in like every subspecialty, be it cornea, glaucoma, neuroophthalm, medical retina, you name it. Like they have short-term these 3-month fellowships in every subspecialty. Then they have this 3-month ICO World Glaucoma Association fellowships. They are basically more focusing on glaucoma, because glaucoma being like irreversible vision loss, so they focus more on it. Then they have the 6-month fellowships for diagnosis and therapy of retinoblastoma, if someone is more interested in doing that. They have these research fellowships also, and they have got this 1-year fellowships in ocular genetics, if somebody is interested in that. Benefits of ICO fellowships. Chaitra ma'am has already said that these fellowships are good for those people who are already more established, and just by seeing or observing things, they can enhance their skills. It's good for them. For a fresh candidate, just going there and observing things, I think it will only help in a way that you can get a broader aspect, like what else you want to learn and how else you want to move on in your life, just that. But otherwise, if you think you're going to learn some like hands-on or some surgical thing out of it, I don't think so. Then it will help you much. So first, the eligibility criteria. What is the eligibility criteria for these ICO short-term fellowships? You should be an MS candidate, like your specialty residency training has to be complete. And these like you cannot apply in your country, like you are in India, you cannot apply for ICO fellowship in India itself. You have to apply it outside. And you should be permanently based and work in one of your eligible countries. India is an eligible country, I'm telling you already. So and the thing is they want you to be already established in your country, because sometimes people have a wrong notion that if you'll go and do fellowship there, then you can get a license there and you can settle down there. It's not going to happen. They want to make sure that you come back to your country. They don't want you to settle down there. So if you're looking out for this fellowship with this purpose in mind, that this thing is going to help you like settling down in that other country, then this fellowship is not meant for you. So all the applicants must be reasonably fluent in the language of the fellowship training center. Say you are applying in Canada or you are applying in Australia, you must be fluent in English. So that way you should be knowing. The ICU recommends that candidates should pass one or more ICU examination, but as Chaitra ma'am told, these are not like a mandatory condition. Many candidates are there who have got the fellowships even without clearing these exams. So for applying, all you have to do is just go to their website. There is a register option. You click on that register, you make an ICU account, select the fellowship, and you have to upload your the documents of eligibility, which will include your nationality, like the passport, your MS certificates. You have to get at least 2 or 3 recommendation letters and the references letter you will need. They'll check your eligibility, and if they found that yes, you are like eligible for this thing, then you have to apply to a host training, which can be like, I applied to Australia, you can apply it anywhere. They have a whole lot of options throughout the world. And if the host is ready to accept you as a 3-month fellow with them, then they grant you fellowship, and these fellowships are paid fellowships. They give you $6,000 US for 3 months, which is a good amount. You can easily manage your going, coming, and even staying there. 6,000 is quite good amount. So this whole process almost takes 3 to 4 months, and these fellowships are granted twice in a year, and their deadlines are 31st March and 30th September. So what was my experience? I did my cornea fellowship in Westmead Hospital in Sydney, Australia, under Dr. Shamin Samar Vikrama. He's a cornea consultant there. So I learned there like in 2 aspects, professionally and personal level. So it was a very well established medical center with advanced infrastructure, good clinical OPD sessions. In OT also I observed a lot of things because I did my cornea fellowships already from the venue. I was doing the penetrating keratoplasties, but there I even assisted the lamellar transplant surgeries here, but there I got to know that there are like so many more techniques to insert the lamellar transplant. So from every person you learn new things. And also during my tenure, there was one more fellow, Dr. Piset Delin. She was from Cambodia. She was also through this same fellowship. By interacting with her, then I also got to know like how in Cambodia the eye banking works. So if you go to such international fellowships, definitely you get more exposure, your mind is broadened, your perspective gets broadened. Socially, I learned new things. I got more kind and calm to the patient. Otherwise, when I was in India, I was like little, aao dikhao, and like jao. But there I got to know that, okay, they are very, very, very respectful to their patients. With every patient, they are more dear, come sit. And like they were very, very, like I got to learn a lot. Like I got more calmer with the patients. And patients are also very patient there, not like here. And so are doctors there. But it was a great experience, and I would really want like all of you should at least once go and do these kind of 3-month fellowships, because it definitely makes you learn new things. Thank you.